All right. Good morning, everyone. My name is Jasper Greenland. I am in my second semester of medical physics, and as such, I am doing my project proposal here. And my project is going to be on a comparison of CyberKnife and proton therapy for pediatric brain tumours. So, if we start out with just a bit of background from each, we'll start with CyberKnife. Thanks to Clarisha's presentation, you guys know a bit about this already. So the gist of it is that it's a robotic treatment delivery system. It's considered to be the height of X-ray delivery LINAC technology by utilizing advanced imaging and some real-time tracking to have highly precise and accurate treatment delivery. And proton therapy, we see here, utilizes a cyclotron, you can see from this image here, to accelerate protons to very high energies. And you can see from this above image as well that they are very useful for treatment because they have this very thin characteristic Bragg peak. You can see the comparison with the photons here. There's a very, very large amount of exposure that photons give to healthy tissue, which this range would be, whereas the protons don't deliver as much dose to that healthy tissue, and then almost no exit dose afterwards as well. So that's also an incredibly advanced technique that is super useful for treatment. Okay, so for my project, some of these aims, I've got to compare the efficacy, the safety, and the cost effectiveness of these two treatments in the context of pediatric brain tumours. And I'm going to be performing like a review paper style thesis, so sorting through all the data and trying to collate it into like one clear educated opinion on which would be better in regards to these three separate things. And hopefully that can be helpful to inform clinical decision making in the future. So let's go into some pediatric brain tumor statistics here. So of the causes of death for children between 1 to 14, cancer is the second highest of this. And of those cancers, 40% of them are brain cancers, which is the highest proportion of any just singular type of cancer of the lot. And we can see here after a 5-year survival, if we're talking about survival rates now, that there is a 78% chance for an additional 10 years after the 5-year survival and a 67% chance for an additional 20 years after the first 5 years. And of the deaths that occur, 83% of them are a result of some kind of relapse or a secondary tumor growth. So these are some fairly upsetting statistics, but I think that serves to really kind of motivate me to ensure this paper I put out is helpful and will improve outcomes for the patients. Because we see here, we've got quite high survival rates, and the long life expectancy, which comes from the nature of having pediatric patients, means there is a pretty likely reoccurrence that needs to be examined. So it's incredibly important that the treatment that these patients receive is minimizing any kind of dose to healthy tissue. And Australia's first proton therapy machine is under construction in Adelaide, so I think that's a further degree of significance as to making this project rather timely and important. So what I plan on doing is a systematic review, analysing all the different papers I can come across regarding efficacy, safety, and cost effectiveness regarding the CyberKnife and the proton therapy treatment, and then applying that kind of thing to the pediatric brain tumour case. I'm going to undergo a meta-analysis using a random effects model, which is to say that I expect to come across a certain degree of heterogeneity in the data, which is to say it won't all perfectly agree based on different sample sizes and different authors and different machines. So A random effects model approach would be applying a higher degree of weighting on the data that is overall more reliable. So that would be data that's come from larger sample sizes or more reliable authors, which you could check by using their H-index, or more reviewed papers with more references. So that kind of thing will get a higher weighting than other kinds of papers that don't have those. And then I'll also aim to perform a cost effectiveness analysis. And I've got 2 references there for some research I've already done into that area, looking at how socioeconomic status can actually impact outcomes. And then hopefully as well, I'll be able to get some expert opinions on the machines, which should serve to provide some unique insights. Okay, so there are already many analyses on these topics individually, and there's actually a very large number of them, which can make it hard to sift through said information from maybe a professional standpoint that's looking for an opinion on informing their decision making. So I'm aiming to get a single overview that contains all of the necessary information from all of these into like a more readable and digestible form for professionals. And they could be hopefully using said paper to make more informed decisions on which treatment to go with, hopefully optimizing the outcomes for the patient. And some potentially related projects there was a master's student, Hannon Dempsey, who did a project last year on the creation of a 3D printed phantom for the dosimetric verification of radiation therapy treatments for pediatric brain tumours. So I think that project could be potentially helpful for mine, as it could obtain the phantom designed could be used to obtain some accurate dosimetry readings, and that could come in very handy when comparing protons or X-rays. Though the lack of availability of a proton machine might make it quite challenging to get any data on that side of things. Although if there's a chance to use a CyberKnife on this phantom, that could prove quite useful. So some problems that I might come across doing this research is the limited availability of data. By that, I mean CyberKnife is a relatively new treatment modality, and as such, finding, like a 10-year post radiotherapy paper would be impossible, really, because it hasn't been around for that long. So most of the data on CyberKnife would be relatively short-term post the therapy. That could prove quite challenging. Another problem would be heterogeneity in the data, which I've addressed by performing a meta-analysis to weight certain data higher than others, hopefully to come to some kind of more universal approach in the data. And then, of course, the technical expertise on these 2 machines. So they're both very highly specialized treatment modalities, and so finding experts to collaborate with may add certain complexity and time to the project. Benefits. So the major benefit of this project hopefully would be a comparison of the efficacy, safety, and cost effectiveness in quite a concise manner. I hope to provide valuable insights into which treatment may be more beneficial given the circumstances of the patient, and then ultimately improving the outcomes for the pediatric brain tumour patients. Okay, so I've got 4 publications that I'm going to quickly run through here that I think will be very helpful for my research. So the first one here is Modern Radiotherapy for Pediatric Brain Tumours. It includes a lot of really great general info. It's actually where I got that figure from the proton dose deposition. And you can see here as well the other figure that I've gotten from this paper, which I think illustrates quite well. The first 2 we have using X-rays, with the second being intensity modulated. And then the third is protons. So you can see quite clearly here, it looks like the beam is coming from the back of the patient, and there is almost no exit dose after the treatment of the brain and spinal cord. And any entrance dose is being delivered to non-vital organs, whereas you can see with the X-rays, there's a lot of dose wash going throughout the patient, which could be potentially irradiating extra healthy tissue unnecessarily. Okay. And for the second publication is a Japanese paper on the proton beam therapy for pediatric brain tumours. So looking a little bit more again into protons here, it includes a lot of really good specifics and tables on. You can see here one of the tables I've gotten, it has a vast diversity of the different types of brain tumours. So there's medulloblastomas and gliomas, and it has a whole bunch of these, and it includes even additional treatments and the late toxicity effects. So I think this will be a very helpful analysis in determining different late toxicities for different types of brain tumours when using protons. The third one here is more now about some CyberKnife. So it is titled The Radiation Therapy for Pediatric Brain Tumours Using Robotic Radiation Delivery System and Intensity Modulated Proton Therapy. So robotic radiation delivery system is what CyberKnife is. So a lot of the data that comes from this will be quite helpful. And you could see as well from, let's flick back to publication 1, the difference here between just standard photons from a LINAC and then intensity modulated photons, very vast improvement there. So in this paper, they're applying that intensity modulation to proton therapy as well. So you can imagine how that would serve to even further improve the outcomes. But what this paper came to the conclusion of is that the robotic delivery systems, which will be applying to CyberKnife therapy, they exhibit a reduced high dose exposure to normal tissue, while the intensity modulated protons exhibit considerably smaller volumes of low dose exposure. So that could be already quite helpful in clinical decision making, depending on where the tumour sits and which tissue needs to be absolutely minimized based on its maximum margins in terms of exposure. All right, and then if we start looking into some cost effectiveness here, I looked at this paper titled The Impact of Socioeconomic Status on Cognitive Outcomes Following Radiotherapy for Pediatric Brain Tumours. So this one I found quite interesting because ultimately, what's the point in comparing two different treatment modalities if no one's going to be able to afford them? So we can see here, one of the main figures of interest I have is this one because it displays the gradients quite separately and clearly. For high socioeconomic status, which would suggest that they're affording the top end of treatments like proton and CyberKnife, the intelligence quotient of the patient post-therapy is actually increasing, as you may expect for a growing child, whereas for middle socioeconomic, it's staying pretty much steady, maybe even declining a little bit. And then for low socioeconomic status, which would suggest they aren't able to afford the top-end treatments, there is a definitive outcome that is worse in terms of the late effects. So the cost of the treatment does have a very tangible effect, what we see from this paper, on the patient's late effects and their outcomes. So I think this data would be quite helpful as well in terms of evaluating a cost effectiveness. Okay, so for the ethics and costs to be considered when undertaking this project, since it is a review paper style, there's no real ethical considerations to be considered or costs, although given the number of papers I've come across with a paywall, we'll see about that. All right, so my time schedule I've put together here. The first green block is this current semester. The blue is next semester, including a little July holiday there. And then green is in between semesters and red will be my final semester. So I'm going to spend the next semester of my study further expanding on the research, finalising which data gets to go in and which data doesn't, and begin drafting up some of the sections. And then over the in-between whole semesters, I'm going to write up a lot of it, and then at the start of the next semester, I aim to finish some of that. Aim to finish that write-up, and then have finalising for references and comments that I can adjust before submitting at the end of 2024 semester 1. Okay, thank you for listening, everybody. Here are some references that I've used.
Excellent. Thanks very much, Jasper.
Thank you.
Okay. Any questions from Jasper? Yes, we have a question.
I've got a question
from James. James, go ahead.
Oh, yeah, you go, James.
Okay, James, probably you're muted.
Sorry, I thought I unmuted myself. G'day, Jasper.
Hi.
Good work on your presentation, mate.
Thank you.
Got a couple of questions for you there, mate. One of them in particular, with the socioeconomic status, I was a bit curious with that because I can understand with that playing a big part in the US, particularly where it's a for-profit healthcare system.
Yeah.
However, with different across different continents, particularly in Australia and Europe, do you think it would play that much of a part in the actual success rate?
Well, I would like to say I hope not, but I think it probably will, because not everyone has access to private healthcare, and I mean, I do aim to communicate as well with the people in charge of that proton therapy machine getting constructed in Adelaide. So I would like to communicate with them and find out maybe how much it might cost for a patient to get into some of that kind of treatment. I mean, there's also the fact that if someone wanted proton therapy in Australia, they would need to buy a plane ticket or spend a lot of money on fuel to travel that far. So there are a lot of various factors, I think, that could still come into play, despite the fact that our hospitals aren't run for as much profit as like the US ones are.
Okay, but with the studies that you're going to be exploring, is that only US data, or is that from a global perspective?
I can check what kind of data that one was. I think it was US, but I would definitely like to be able to look into the data that comes from non-US data as well. Yeah, okay, so here it is. Yeah, naturally, that one is United States, as expected. But yeah, I'll hope to have a deeper analysis on other nations as well.
Okay, perfect. And then I got one other question, just because I couldn't help notice, but with the cases of the last two presentations with Claricia's and also Juliet, it was also there seems to be quite a bit of a lack of data associated with treating a lot of patients. Have you actually also considered putting forth recommendations on data points for clinicians to keep a track record of their patients to help with future research?
That's a great idea. Yeah, I think given the close communication that Charlie's have and their CyberKnife with the UWA Medical Physics, I think that's a really great point that I could communicate with some of the people working over there. That would really help be able to track how some of the outcomes from the patients come through.
Okay, perfect. That was all I had.
Thank you.
Yeah, Jake.
Yep, sorry, I forgot to lower my hand. James actually asked exactly what I was going to ask, which was that was that data actually from the US or for a healthcare model that is predominantly for profit? Because I guess I can just change this to more of a comment. I do suspect those conclusions might change if you were sort of covering those costs and the patients didn't have any out-of-pocket expenses, maybe, as you said, except for the fact that they might have to travel to Adelaide to get treatment. So yeah, already asked, all good.
Yeah, I do still aim to have my analysis applicable worldwide. So I could break up the socioeconomic sections based on
Yeah,
the
that's
information as well.
understandable.
Yeah.
Yeah, that's probably a good idea. You could even break it down into different sorts of healthcare systems.
Yeah.
But yeah, I mean, potentially even you could quantify the costs to the healthcare system in general, right? Because the costs are still being covered somewhere. It's just not taken out of pocket for the patients.
Yeah,
rather
exactly.
It's being covered by tax dollars. So yeah, just potentially like an overall cost measure maybe. But yeah, that's something you could do.
Great idea. Thanks.
Brilliant. That's great. Yes, we have long discussions yesterday regarding this topic. I'm glad, Jasper, you bring it up. Just make it clear for us regarding the cost and importance to have this modality in our state. So next is Clarissa.
Yes. Just branching off from what Jake and James have already asked, are you planning on capturing any other measures for these outcomes? As socioeconomic status and reading and writing is a very complex topic and measure, and I'm just wondering whether there's been any other outputs that you've considered measuring to try and capture the results of these, the outcomes of these patients?
Yeah, absolutely. So this study was focused on some neurocognitive dysfunction as a result, but there are several other late effects like hearing impairment, for example.
Okay.
So yeah, there are some papers I've read that encompass a larger degree of late effects. This one was just specifically more focused on the IQ side of things.
Yes, fantastic. I guess because we know in science a correlation is not always causation, and sometimes there might be always. Oh, feedback, terrible feedback. Sometimes there might be other factors influencing.
Someone needs to mute.
Oh, that's better. Oh, yes, sometimes there might be some other factors that might be influencing the children's development after something like this.
Yeah, maybe they're not going to the same schools and stuff like that.
Correct. Yeah, very complicated topic. So that's fantastic, though. Those other outcomes will be
for sure.
Very, very useful. Great stuff.
Okay, brilliant. Thanks very much. Any other questions? All good? Brilliant. If you could please, Martin, turn off the recording.